Hey people, welcome back to HealthSparx, featuring the brightest entrepreneurs and innovations from the health and technology arena. I'm your host, Michael Walsh. Welcome to another excellent episode. My guest today is incredible. It's Ari Tulla, the co-founder and CEO of BetterDoctor. We're all looking for doctors these days, right? I mean, everybody's in that position where we've got to make sure that we find a doctor nearby that meets our insurance, that can handle whatever case it is that we're dealing with, whether it be for us, our parents, our kids. It's just an issue, right? Everybody has it. It's not just a healthcare issue, it's a life issue. BetterDoctor is working to solve this. They've put together a huge database of doctors all over the country that meet your criteria, and not just doctors as well. It's dentists, it's OBGYNs, it's pediatrics, it's all sorts of stuff. So incredible website, incredible user experience. Very excited to have Ari here to tell us all about it. A quick reminder, a little bit about what we're all about if this is the first time you're stopping by. HealthSparx is all about the best stuff in health and technology right now, meaning any of my guests from any of my shows could be launching companies or products that could save you as a patient, as a consumer, tons of time, cash, or just make your life like 1,000 times better. So pay attention to these people. That's what HealthSparx is all about. That's why I'm doing this, bringing all of these innovative entrepreneurs, these incredible professionals to the show to talk about what they're doing or what's going on so it can make your life a little bit better. So that's what we're doing. Thanks for stopping by. Very excited you could be here. Before we get started with Ari, I want to remind you to subscribe to HealthSparx. You can do so here on the website. It's healthsparx.com/subscribe, or you'll see it if you're watching the episode here right above, top right-hand corner. You can subscribe, just drop your email address in there. All this means is that every Tuesday morning when I launch a new episode, I will deliver it straight to you with a quick description of who the guest is, what they can do for you, and send you the links. That's it. No spam, no junk, I promise. So be sure to subscribe here on the website. I would appreciate it. And then, of course, you can catch us on iTunes, Stitcher Radio, and join in on the conversation on Twitter. Hashtag HealthSparx. We're taking questions all the time. I'm always meeting new people and trying to solve problems through Twitter as well. So we'll be very excited to meet you out in that channel. All right, I think that's about it. Let's get started with today's show. Again, it's Ari Tulla, the co-founder and CEO of BetterDoctor. All right, everybody, today on HealthSparx, I've got Ari Tulla. He's the co-founder and CEO of BetterDoctor. It's a company that launched, I don't know, just from reading about us, but it sounds like we're here within the last year or two. Am I correct, Ari?
Yeah, about 2 years ago.
Awesome. So, I mean, the basic premise of this company is incredible. Like, these guys are helping people find doctors, dentists, vision, OBGYNs, all sorts of stuff. Kind of a similar concept to ZocDoc. We'll get into this, but real great concept. They've launched it here about 2 years ago, so excited to welcome Ari to the show. All right, my man, how are things? What's going on?
Things are great. We've been having good fun here in the Bay Area and building the company for the last about 2 years now, and really got to the market just about 8 months ago at the TechCrunch Disrupt last fall. And ever since we've been building more features, adding more doctors, and now we're really happy to announce that we have all the doctors in the country. We have about 1 million doctors and dentists on the service. So if you go there, you can find at least somebody. I'm about certain about that.
Yeah, I spent some time playing around with it this morning. I got to tell you, I love the user experience. It's incredible. I love the color schemes. I love how easy it is to get around. The mapping system is fantastic. As soon as you do a search, the system is automatically doing a geolocate to figure out where you're at and telling you the closest doctors or whatever it is you're looking for. So congratulations, man. The site is incredible. Very excited to learn all about it here on today's show. So before we get too much into BetterDoctor, let's kind of start with you. You just were telling me before the show you're from Finland. So give us the rundown about your background and how you came to be the co-founder and CEO of BetterDoctor.
Oh, that's a good question. It's a long way from Finland, northern part of Europe, into the Bay Area, about almost 10,000 miles away. So I actually started with the online IT on the last bubble. I think 99, 2000. I was helping my friends, and we built a company in Finland and got it growing. It's today about 70, 80 people. I left it a long time ago, and after that, I decided to finish my studies. That was a good idea. I did some business studies, also have a degree on computer science, somewhat unfinished, but I can say it's done deal in my mind at least. That's the normal story when you go into the entrepreneurship. After that, I ended up doing some marketing, brand management, a lot of different things in Europe. Spent time in England, in Norway, Sweden, Stockholm. Lived around Europe for about 4 or 5 years. After that, I got an interesting call from people at Nokia. So I ended up into the big Finnish cell phone company. Not work on the cell phones, but I worked on the game side of things. So I was in the
Cool.
team building the first mobile games. That was quite a while ago. You might have heard about N-Gates, the side-talking phone that was the first gaming mobile device. That was
Cool.
2005, 2006 timeframe. So quite a while before the current big companies like Rovio or the others.
Sure.
And
All right. So
that
yeah.
kind of led me, of course, it's a global company. So about 5 years ago, I moved into the Bay Area to build a new game studio here. And after a while, I decided to do something else. And really, I mean, I think my story is very typical for any healthcare entrepreneur who comes from outside the healthcare. So I had some family medical issues already 10 years ago, and been battling with those for almost 10 years. And really 5 years ago, it started to be even more complicated coming to the US. And of course, we all know about the healthcare system here is a bit
Right.
different than in other countries. And we struggled a lot with my wife on finding the right doctors, finding the right care. And about 2.5 years ago, I really got really fed up with the whole system because we just couldn't find the right person. And ended up spending about 2 months' time on searching different directories, used all the websites, talked to Stanford hospitals, and tried to be very proactive. But I really couldn't find the right tools for myself, and that ended up in the let's say 6-month thinking period. Kind of turned out to be a feeling that hey, maybe I could do something about this. I know a lot about building a great user experience. I know about building, a scalable service for consumers. I've been building things for tens of millions of people before. And I looked at the space and really didn't see anything that I like to use myself. And then I found my co-founder, who's a friend of mine and my coworker at Nokia for the last many years. And he got excited about the whole idea as well. And with Tapio, we decided to put the company together about 2 years ago from today.
Congratulations. Well, yeah, wow. Where do I start? Let's talk a little bit about what it is. So it's I don't even want to use the word directory. I mean, it is a directory, but it takes it a few steps further than that. So kind of tell us a little bit about it. What is BetterDoctor?
It really today, if when you go to the site or you download our iPhone app or you go there on your mobile device, it really is a simple way to find a doctor. And I looked at the market a lot, and I felt that to me that simple thing of finding was the biggest problem and crux. So focus on that. And of course, you can't do that easily without doing a lot of work around the data. So
Right.
we were talking with Tapio early on that hey, it will take about 6 months to get the product out, and it ended up taking almost a year and a half because of the data. We had to build the whole nationwide database. We need to understand who are the good doctors, and that's not an easy question to do. I mean, it's very very complicated and multifaceted problem. So really.
Yeah.
Today, what we do and what was my problem, we focus on a few things in the beginning. So when you look for a doctor, you of course need to find somebody who is the right for you. And finding the right doctor is again complicated, but you can distill it in a few things. You need to find a doctor who's nearby. That's the first thing. You're not going to travel 100 miles away. You need to find somebody who is specializing on the problem that you have. So then you need to find the right specialist. You also need to find somebody who is accepting your insurance plan. Otherwise, you might pay $1,000 instead of the copay of $30. And
Right.
then finally, I think you want to find somebody who is well credited, who is validated to be good at what they do. And that's part of the consumer reviews. That's part of understanding about the school they went into, understanding the medical license, the board certification, malpractice, and all that other stuff that is very complicated
Right.
to come by. So we've been kind of putting that information together and building this service now what we have live.
Excellent. So you just mentioned a second ago. So you've got every doctor in the United States now listed in BetterDoctor, right?
Yeah, that's well, there might be a few who are just retiring or retired or coming from the med school. So we can't keep it absolutely up to date, but it's pretty comprehensive.
All right, so let me ask you this. You mentioned, so but the driver for putting this all together is that you were looking for doctors. You didn't feel like the user experience for some of these other websites out there was all that positive, so you decided to build this. So in building it, what's the real differentiator between this and some of the other stuff that is out there? Like, what makes BetterDoctor so much better than some of the other websites that are currently out there?
I think the number one thing that I had in mind is that I'm building a service for you and every other consumer who is struggling today to find a doctor. So we didn't take a stance on building a money-making machinery, but we started to focus only on the consumer. Can we build a service that is very easy to use, where you can find the right doctor with few clicks? And the fewer clicks possible, the better for us.
All right, so that being said, though, so how does the business work? What has been the business model to this point? I mean, you've got the database set up, so I'm guessing that you've also kind of set up the doctor as your customer in this case to be able to list themselves here or something like that. So what's the model for this?
Well, let me continue a little bit on the previous. So on that note, so the quality becomes the essence in my mind, because this is a market that I've been telling this to many people, and I like the anecdote in a way that when you are looking at the healthcare, it's a lot like hotels.com, where you take the price out. So every hotel room would be $100 in a big city. And then people would be, of course, flocking into the 5-star place. Nobody would go for the 1-star location. So that's in a way what healthcare is today, because you really don't have the price difference. If you have an insurance plan, you're going to go to any doctor you like who is accepting your plan, and you're going to pay the same amount of price. So you don't really use a distinction of price that is almost in every market that you have on the web and offline. So the quality and the convenience becomes the key factor. It becomes the key element. And that is making the market unique. And because of this fact, we started to look at it in a way that, first of all, we have to have all the doctors in the system, because you can't discriminate. You can't make it like Yellow Pages, where you only have few doctors who are paying for the system. That is unfair to me. And what we did next, we looked at it in a way that we need to have some quality layer on top of it. So we have defined a quality criteria for a better doctor, and certain number of the doctors out today, out of the million, are qualified better doctors. Not all, because we can't find enough information of all the doctors, or some of them might not be qualifying on the criteria. So what we do on the business side of things, so the question you were asking, we basically are looking at this in a way that, of course, we need to get the doctors on board, because they're the only ones who really know exactly what do they focus on. What is the specific area that this doctor wants to focus? I mean, we know their specialty, we know their education, we know that stuff, but that's not enough always to know exactly that, are they focusing on Lyme disease? It might be a lot broader what they actually do based on the education. And to understand that, we have built another side of the system. If you go to doctor.betterdoctor.com, the doctors can claim a profile, they can sign up to the system, they can edit their information, they can never hamper the quality criteria. But they can add more information in a way that we can match them better to the right patients. And today, we are making that free for the doctors. So at this point, really, you could say that the Better Doctor is quite pro bono, because how do we finance this is by the financing we've been getting from the venture capitalists in the Bay Area. So today, of course, they want to see a business model, and there is a model that we are building today. But at this point, it really is a free system for the consumer, for the patient, and free for the doctor.
Awesome. So go back a second to the quality scale with each of these doctors. How are you judging them on quality?
That's a really good question, and I spend a lot of time on my mind on this, and we are doing some unique proprietary things today that I can't call today because of some things that we are doing on filing, protection for the ideas and the innovations. But I can talk about what we say today on the website, and we started a very simple idea. We believe that a good doctor is somebody who has valid education, has a board certification, doesn't have serious malpractice or medical claims on top of their record, who has been doing the things that they say are doing long enough, and also who is well regarded by consumers and peers. So it's not always only the consumer ratings, but it has to also be somewhat about what are the peers saying. So we are looking at a lot of different data points coming from doctor referrals to some of the consumer reviews and consumer recommendations and so forth, and combining that together to build an algorithm that is ranking the doctors in some way.
I mean, is that ranking made public to me as a patient as I look through the system, or is it just kind of behind the scenes?
Today we haven't quantified the ranking for you as a consumer, but if you're looking at the site or the mobile app, so you can see that there is a BetterDoctor badge, BD, purple symbol that is defining that these doctors are validated by us. And today we've been able to validate about 250,000 doctors out of 1 million. So it's a fairly good number already that we've been able to do. And it's half manual stuff, so it's been taking a lot of time from us.
All right, so one of the other parts about this as well, I don't think we've mentioned this yet, is that can you set appointments through this with these professionals?
Yeah, so that's another great question, and I think if looking at this market, in healthcare, unfortunately we are almost 10 years behind of many other industries out there. So I mean, think about if you book a flight, you can't even make a phone call. You can hardly get anybody to talk to you at the airline or at the travel site. That's almost impossible. But in healthcare, phone is still today the predominant way of communication.
It's backwards, right?
It's backwards, and I think we all know the reasons. I mean, we can go there later and talk about those. But today I was looking at this a lot myself, and I wanted to build a system that can work nationwide. And if you only go and say that we're only going to do online booking from the beginning, it's going to be very, very difficult to scale it today because you don't have the systems on the back end, on the doctor side, that can talk to you easily. So we didn't take a shortcut. We took a stance that let's make this available for everybody by phone first, and then let's build the deeper integrations when we go forward.
Okay. All right. So I'm looking at the website now as we're sitting here talking about it. So one of the things that's also here again is you've made the phone numbers available. You just have to kind of click and then you'll show it to them. So I'm curious. This was from this morning when I was playing with this because we've kind of come across a similar hurdle with my startup with CareLoop. So you've got this database of all these doctors. Now, for me as a patient, I come to the website and I find the doctor that I probably want to contact and I want to try and make an appointment with them. But maybe they haven't signed up yet for your system. It's just kind of the basics. So how do you handle that situation?
Yeah, that's a good question. That's why partially, of course, we want to do things like you can click the call button, and at least we understand there's initiation, something happened there. We give you as a consumer option to save the doctor to your favorites. If you sign up, you can save the doctors to your favorites, and keep a record of all your doctors, your medical team, like I used to say. And how do we get that loop closed? I mean, that's a very critical and important point for any marketplace and any startup. I mean, you have multiple different ways. You can use those click to calls. You can use some call tracking services, and you can reroute phone calls and so forth. There are multiple different ways how you can actually close the loop and be able to validate that this many calls were done by our system. And I mean, I'm happy to say that I think I talked to somebody in media last week that we've been helping 2 million people to find a doctor since the launch. So we are pretty happy about the traction and the numbers that are growing pretty nicely. The curve looks wonderful at this point. And that's kind of the idea that we are looking at. A lot of people are coming there, a lot of people are doing something, and of course we are now tracking some of them to understand exactly that how many calls are we placing at what time, are they becoming bookings, are they becoming visits and so forth, that the consumer is getting real value, and the practice also and the doctors are getting value out of the system.
I'm sure that that data is probably pretty fun to look through, just to kind of see the behavior of all the different consumers and how they're going through the site. I'm curious, as we've been talking now, let's wrap up a little bit on BetterDoctor. I want to ask you some real big picture healthcare questions, just because again, you're in this space, you're clearly trying to solve a giant problem. So really want to hear what you think about some of these things. But what's one of the biggest problems you've come across in launching BetterDoctor? And you may have just mentioned it a second ago with the whole concept of the fact that healthcare is backwards. But what's one of the real big problems that you guys have faced up to and tried to solve as you've launched this product?
Well, I think the data has been by far the biggest one, because I had no idea that you can't find a list of doctors in this country, and medical professionals are pretty regulated in a way that you need to have a license, you need to have a permit, you need to have all that, but still nobody can give you a list of doctors who are practicing today. That sounds crazy to me, but that's the reality. You can take the NPI database that I think a lot of us healthcare companies are using as a backbone, and you find out that it might be 40% incorrect. The phone numbers are wrong, the addresses are wrong, the names are wrong, a lot of incorrect and wrong information there. So that was a hard thing. So we have actually built similar tools that Google is using today to parse data, and we are parsing data from 1,000 different sources. So we have a pretty complicated system on the back end where we are building the database based on the data is out there. Of course, we work with other people, like some companies who have gathered data already. We buy data, we license data, we switch data, because that's so hard to do today that you really need to play ball with other people. And I think another problem that or the challenge that we have faced is how do we really make this scalable for everybody? Because I really wanted to do, because this is like my baby in a way. I want to be doing something that has a mission, that has an impact, and I think the impact only can be big enough if you can provide it to everybody. And this really is a unique problem, because I don't know if you know or you have read the data, but 80% of Americans are looking health information online any given year, and that is more than people are buying goods online or people reading news online. So
and again, doesn't that just go back to the problem that, again, healthcare? That's funny that the consumers are all there, right? But healthcare is not there.
I couldn't agree more. And I was also baffled by we have a lot of doctors who are now using the system already, and we find every day doctors who absolutely have no website, and they are just very happy about the fact that they're going to have some presence online, that they can actually have a simple tools that they can edit the information, modify it, and feel that, hey, now I'm there, I can drive people in some direction that actually looks decent. And that really is interesting in a way, because now if you are a small business in other verticals, if you are a restaurant and you have no website, I think that's very rare. But there are still like 70% of doctors who don't have a website, and to me that's crazy.
I just had that same conversation with one of my customers yesterday. Signed her up for Caraloop, but she has no such website. She's not. But before Caraloop, she wasn't located on the internet at all. It's like, well, this could sort of. She asked me, "Can this be my website?" Like, quote unquote. I'm like, I guess if you want it to be, if you really don't want a website, I guess this could be your website. So, yeah, duly noted. It's certainly an issue, and it's something that is a good segue into something I'm going to ask you next. What are you most excited about as we look forward at healthcare the next 4 or 5 years or so? What are you most excited to see?
I think I'm excited every day. I come from a place that is very, very fast moving. The mobile, the games, the web. I have seen transition in the gaming from boxed games to online games to mobile games. I was one of the first people looking at that very closely. So I'm always looking at new markets in a way that, okay, where are we in a shift? Is it happening today? Is it going to happen in 10 years? I really feel that the healthcare is going to be transitioning right now. We are in the midst of the whole thing, and that is super exciting, because we are not looking at the market that is only impacting few people. It's impacting us all, and it might actually bankrupt this whole country. So we need to fix it.
It's serious. You're not lying.
And that really the excitement is boiling also on looking at more what we do today. And I talked about the quality a little bit. I would love to go more in detail there, but there are some things that we haven't publicly announced yet. But just looking at the data that is coming out now from CMS, coming out from the government, and there really is a mandate for data openness. And I'm hugely excited about this stuff, because to us, if we want to be, and as we want to be at BetterDoctor, the quality leader, it's not enough for having consumer reviews or having some nice to have information. We need to have deep information and understanding about how do we evaluate the quality of doctors? How do we evaluate not only quality of, let's say, the generic quality, but really the specific operation-based quality? And I mean, I think that's going to happen in next 2 years. And I want to be one of the first people in my company to take advantage of that data and be able to give it you as a consumer in a way that you can make a good decision, not only based on a feeling or not only based on one friend who had an idea that this doctor might be a good one.
Yeah, you couldn't be more correct, Ari. Like it's great to hear you say some of these things because it's almost a mimic of exactly how I feel about healthcare right now. Yeah, there's a lot of challenges, there's a lot of issues, there's stuff that's just it's downright broken in a way, but I couldn't be more excited about it. Like people think I'm crazy, but there's so much great stuff going on right now, so I can't wait to see what it's all going to add up to be. So, and BetterDoctor being just another
and I think
example.
Another point on that, sorry to kind of jump on that, but I mean, another point together with the data openness is really that because we are so in deep in the trenches on the spending curve, we are spending too much money. We need to cut the spending. We need to become more effective. And being online, praising the cloud, is maybe the only way to make it more effective without cutting the salaries, without cutting the number of people we treat. So we need to really make that happen. I believe that will happen, by the way, now finally, and it will happen in a more unified way. We're not going to have 500 companies providing EMR tools. We're not going to have 500 companies providing online booking solutions. It will be a smaller number of players who are big, who are going to praise the APIs, who are going to be more open. They're not going to be like Epic that you can't even talk to.
Right. Well, and that's a perfect segue to one of my last questions here. And you can answer this based on your experience with BetterDoctor and as a patient. But that being said about healthcare and just it needs to be more cloud-based, it needs to be more effective. How can we convince healthcare to be there? What can we continue to do as entrepreneurs, as patients, as caregivers, as consumers, whatever you want to call it? What can we do to get them there?
I think I've been talking about this to many people, and my view. I mean, again, I'm a newbie in the field. I've been in this, for 2 years. I try to be a fast learner, but I don't know everything yet. I know a small slice. But what I have seen, I firmly believe that the change will not happen by the big government, by the big pharma, by the big players. It will happen by the patients and the consumers. And let's call the healthcare consumer a consumer, not a patient, because we need to consume healthcare when we are not ill, when we are not feeling bad, when we are actually living our normal life. And that's the only way when we can take care of our health. And there's a mindset shift that is happening a lot now around the US, I think, that is about I want to take care of myself. It is my responsibility to take care of my health. It's not going to be the healthcare, the insurance company. It's not going to be my employee. It's going to be really, you and you only doing it. And then we are now getting the new online tools available. We have the Quantify Self movement that is one idea and one a glimpse of what world could be when people are getting the data in. You can't use that data on anything yet. You can't take it to your doctor. But that is one element that will be more what we see in the next coming years. We will have tools available that we can actually do something cool. I mean, I'm excited about, like the new products like the Xanadu tricoder coming. I hope I get it in a few months. And you can, do some simple testing at home without going to the hospital, without going to the practice. Because some of the stuff that you're going to be done, my wife, and we've been at the hospital many times, and, we were just talking today, like, why do you always need to measure the blood pressure 5 times when you go there? We have already done 1,000 times. It's not going to fluctuate that much. You could do it at home and tell if it will change. Might be easier than spend that, a few minutes every time you go somewhere.
I agree. Yeah, and as a former Trekkie myself, I also can't wait to see that little device come out. So, very excited about that. And you're right, man. The power of the patient the curve is rising, right? Like with all this great innovation, it's all geared towards putting choice back into like a lot of the patient's hands to educate themselves better, to actually make better decisions, to make more cost-effective decisions, whatever it might be, whatever the company is aimed at. the trend is definitely changing, and it's shifting back towards providing that patient with options. So it's a lot of exciting stuff right now, right? It's going to be a crazy next 5 years.
It's going to be fun, and I mean, at the same time, it will make a lot of entrepreneurs very important in a way that they will change some of these big old systems, and there will be big impact for people. But also, it will make a lot of people very wealthy, and there will be a new breed of, I think, healthcare entrepreneurs who will make a lot of money in this space, and who will then help other companies and other entrepreneurs to succeed by becoming angel investors and so forth. So, I mean, I applaud for you on doing this, what you do, because we need to get people outside the healthcare to come on the space and really get excited and see that it's not that complicated. You can use stuff that you learned elsewhere and apply it into healthcare in a new way.
Absolutely. I couldn't think of a better closing line, Ari. This has been great. I love the product. And again, the user experience is fantastic. To anybody listening, you definitely got to go check out the website. It's betterdoctor.com. I'll have links here on the website on the episode page, and you guys can check it out. So best of luck, my man. I can't wait to see all the success that you guys are going to bring to the market, and I can't wait to follow and see what's next for BetterDoctor. All right, that'll about do it for Ari and I. I got to tell you, just listening back and thinking about some of the comments that Ari has made during this episode, I got to tell you, this is probably one of the best episodes I've put together. I mean, Ari he's originally from Finland, has come to America. He's an entrepreneur. He's launched a great product, but he's also, like he mentioned early on, he's a patient. He's constantly utilizing the healthcare system to go to the hospital for him, his wife. So such great perspective from Ari when he sits here and says that there's a lot of stuff that's broken, but he could not be more excited about where things are going for the next 5 years. And that's such a profound statement. And again, a testament to what HealthSparx is all about. So very gracious and very grateful to Ari for being a part of the show today, to come and talk to us about what BetterDoctor is doing, but also to share some of that feedback and that insight about where our country is headed. Before we sign off, of course, I want to remind you guys to please subscribe to HealthSparx. It is right here on the website. You can go to healthsparx.com/subscribe. All you got to do is pop in an email address. No other personal information, no spam, no junk. It's just my way of delivering the content to you every Tuesday morning when I put together other awesome episodes like this one. Just a way for me to get it to you. So that'd be great. I appreciate it. healthsparx.com/subscribe. And that is about it for today. So until next week, I am your host, Michael Walsh. Have a good one, and we'll talk to you soon.